Diabetes at home. Diabetes at home. Living with diabetes is sometimes hard. Diabetes testing at home is not the let alone factor of testing diabetes at home. A doctor has to carry HbA1c tests, fasting tests, oral glucose tolerance tests, or perhaps a blend of these for the reasonable diagnosis. And sometimes you will have to take care of this for yourself. Manage diabetes at home permanently. Home diabetic remedies. Diabetes? Oh no. How can I get rid of it? How can I manage it? Is there a way to manage diabetes at home? I know these question pops up to all those battling with the diabetic disease. Testing blood glucose, sugar, is a fundamental piece of your diabetes care plan. Contingent upon your present condition, you may need to visit your primary care physician a few times each year for formal testing. Self-observing your blood glucose might be crucial to your treatment. Testing your own levels permits you to figure out how to deal with your glucose regardless of the hour of day or where you are. High glucose happens when your body can't adequately transport sugar from blood into cells. At the point when left unchecked, this can prompt diabetes. One examination from 2012 revealed that 12 to 14% of US grown-ups had type 2 diabetes, while 37 to 38% were named pre-diabetic. Managing diabetes at home is very straightforward. Just get used to the following steps beneath: exercise. Exercise builds insulin effectability and enables your muscles to get sugars from the blood. This can prompt diminished glucose levels. Great types of activity incorporate weightlifting, lively strolling, running, biking, moving, climbing, swimming, and the sky is the limit from there. Control your carb intake. The American Diabetes Association (ADA) suggests controlling carb admission by tallying carbs or utilizing a food trade framework. Carbs are separated into glucose, which raises glucose levels. Diminishing starch admission can help with glucose control. Increment in your fiber intake. Eating a lot of fiber can help with glucose control, and dissolvable dietary fiber is the best. Nourishments that are high in fiber incorporate vegetables, natural products, vegetables, and entire grains. The suggested everyday admission of fiber is around 25 grams for ladies and 38 grams for men. That is around 14 grams for every 1,000 calories. Remaining hydrated. Indeed, this can lessen glucose levels and help forestall diabetes. Water is the best. Remember that water and other non-caloric refreshments are ideal. Sugar-improved beverages raise blood glucose, drive weight addition, and increment diabetes chance. Try eating berberine. Berberine is the dynamic segment of a Chinese herb that has been utilized to treat diabetes for a large number of years. Berberine functions admirably for bringing down glucose levels and can help oversee diabetes. Be that as it may, it might have some stomach-related symptoms. Fenugreek seeds. In spite of the fact that not excessively well known, fenugreek can without much of a stretch be added to prepared merchandise to help treat diabetes. You can likewise make fenugreek flour or mix it into tea. Fenugreek seeds are likewise viewed as perhaps the most secure herb for diabetes. The suggested portion of fenugreek seeds is 2 to 5 grams for every day. On the off chance that you'd prefer to attempt it, Amazon has an enormous determination accessible. Actualize portion control. Segment control directs calorie allow and can prompt weight reduction. Here are some useful hints for controlling segments. Quantify and gauge partitions. Utilize littler plates. Maintain a strategic distance from everything you can eat eateries. Peruse food marks and check the serving sizes. Keep a food diary. Eat gradually. Important information: home testing follows these general advances. Wash your hands. Put a lancet into the lancet gadget with the goal that it's all set. Spot another test strip into the meter. Prick your finger with the lancet in the defensive spearing gadget. Cautiously place the ensuing drop of blood onto the test strip and hang tight for the outcomes. Most diabetic at-home tests need a lancet, little needle, and a spearing or lancet gadget to hold the needle. Test strips. A glucose meter. Compact cases. Lines to download information if necessary. Wash and dry the hands before taking care of the testing unit. Fast facts: a few strategies suggest purifying the testing zone with a liquor swab. Quick changes in glucose may not present precisely in less touchy regions. The finger is normally best when checking for fast changes in glucose. Most lancets permit the client to set how profound they infiltrate the skin. Individuals with thicker or drier skin should set the infiltration higher. Before spearing the finger, position it against a strong surface. Apply the spear immovably, however not strongly. Delicately crush the finger while holding it at chest level and permit a drop of blood to stream onto the test strip. Note and record the blood glucose perusing following each test. A few people with diabetes likewise utilize an elective blood test to quantify glycated hemoglobin (HbA1c). The method for this test is, for the most part, the equivalent, however, it will deliver various readings. Once in a while known as A1C, the test demonstrates glucose levels more than half a month. Time tenure for diabetes at home: early daytime fasting reading. This gives data about blood glucose levels before an individual eats or beverages anything. Taking blood glucose readings before eating gives a gauge number. This number offers pieces of information about glucose forms during the day. Prior to a feast, blood glucose before a dinner will in general be low, so a high blood glucose perusing right now recommends troubles overseeing glucose. After a supper, post-dinner testing gives a smart thought about how the body responds to food, and if sugar can arrive at the cells proficiently. Blood glucose readings after a dinner can help analyze gestational diabetes, which occurs during pregnancy. Most specialists suggest testing around 2 hours after a dinner.